equity, fairness, and justice. These are the values we share and the values we expect our local elected officials to lean into. These are the values that must guide the response of our local government to the crisis that is COVID-19. How can our public health departments and elected leaders apply our shared values in the age of COVID? One way is to collect and release demographic data, including information about race, about the impact of the virus in our diverse region. COVID-19 is hitting communities of color hard, and this is especially true for Black people across the country. This is true in our state as well, where we see a disproportionate impact on Black Californians, along with clear disparities for Latino individuals. We also see disproportionate impact in Asian and Pacific Islander communities here in California. Why is COVID-19 disproportionately impacting the nation's Black population and other communities of color? Racial disparities in healthcare, policing, and incarceration, and who holds essential jobs are factors that make people of color among the most vulnerable to COVID-19 infection, serious illness, and death. For instance, we know that one way to flatten the curve has been social distancing, 6 feet of physical space between people. Well, you can't practice social distance in jail. You can't have adequate physical distance in many service sector jobs. And who are more likely to hold these jobs? That's right, Black and brown people. Across the country, only 1 in 5 Black people and 1 in 6 Latinos have been able to work remotely. This means a larger number of Black and Latino people in the workforce cannot stay at home during this deadly pandemic, making them more likely to be exposed to the virus. Decades of racist policies and government neglect have left communities of color under-resourced, underinsured, and with higher rates of pre-existing health conditions that make them more likely to become seriously ill from COVID-19. We know that Black and brown people are at a higher risk for COVID-19 infection, illness, and death because of racism. Well, what do we do with that information? We act on it. But to know where to drive resources, it is critical that our local governments collect and release racial and other demographic COVID-19 data that honors privacy rights about testing, confirmed cases, hospitalizations, and deaths. We cannot manage what we do not measure. Without this data, our elected officials will continue to miss the mark and exacerbate health disparities among people of color. It is also important that in San Diego County, we create a COVID-19 equity task force to help ensure the county's response and plans for recovery center racial justice and equity. You can help. Please call and email the County Board of Supervisors and tell them to release equity data. For those who live in San Diego County, we ask that you also call on the supervisors to create a COVID-19 equity task force comprised of city and community leaders. We the people must address this pandemic through a racial justice lens and act to protect those in our community who are most vulnerable. Go to this action page to email your San Diego and Imperial County supervisors directly. Let's work together to flatten the curve of inequality.